Hi girls, so this week's topic on The Crunchy Life is all about legal hassles around our lifestyle choices and our parenting choices, whether we've been hassled by doctors or school or law enforcement or Department of Children's Services, which in Australia is DOCS, or anything like that. And I was struggling to come up with anything on this subject because I haven't actually ever had any hassles with anything. I guess the main hassles that I assume that most people would have would be over vaccinations, and my 3 older children are fully vaccinated and Amelia's selectively vaccinated, and at this point, because she hasn't been in daycare or preschool or even been to the doctors for that matter, no one's ever asked about her immunisation status, so we've not had any hassles about that yet. Even our family, I don't go into great depth with my family about what she's immunised for. They don't even ask anymore. So the only really thing that's ever happened to me was after I had Amelia. Unfortunately, I didn't get to have a home birth with Amelia, and we went to the hospital. I had a water birth and I wanted to be discharged straight from birthing suite. I had no intention of staying at the hospital. I've been there before. I know exactly what it's like, and there was no way I was going through that again. So the registrar on duty came in and was all lovely and, oh yes, we'll just weigh her and measure and write down everything we need to know, and then we'll discharge you. And then she went off, came back 5 minutes later and said, in the sternest voice I guess she could possibly throw at me, was, I've just read your chart and you're strep B positive. You're going to have to stay for 24 hours. I said, I'm not staying for 24 hours. I'm a registered nurse. My mother-in-law's a registered nurse, and I'm not staying. So give me the papers and I'll sign myself out. Well, you'll be signing yourself out without medical, whatever. I said, I don't care. I'm not staying here. I've heard too many horror stories from my mother-in-law, who works at the hospital, of postnatal ward, and there was no way I was doing it. So I didn't really know what I was going to talk about in this video, so I decided to go into a little detail about what is happening in Australia regarding our independent midwives, because a couple of years ago, 3 years ago, the federal government brought out a what do they call it? A bill to pass on nurse practitioners and midwives in Australia. And the idea was that the government was going to allow the nurse practitioners and midwives to provide services that were funded by our Medicare benefit scheme, which is all the doctors and anything that you go and have done, you pay, the government pays a certain amount of our health, for our health services. So it's called the Medicare benefits scheme or schedule. So certain medications are provided under that, a certain amount of them, so that when you get to a certain amount of money that you spent on medications a year, then you can claim more back from the government. So what happens is, if we go to the doctor here, we pay $65 for just a consultation, and we get about 38 of it back on Medicare, and they do that straight away. You pay the $60 off your debit card or whatever. You give them back your debit card and they put it through, and the Medicare goes straight back onto your debit card, so that you only pay $25 less on actual money. Some doctors still bulk bill, which means that when you go in, you just pay the Medicare amount. There's not a lot of doctors that do that now. There's only one in our area that bulk bills. So the idea was that nurse practitioners and midwives in Australia would be able to use the Medicare system to help subsidise their work and people's care. It did not extend, however, to cover home birth midwives or to cover home births. And the biggest part of the Australian Medical Association's submission for the bill was that practitioners and midwives would have to collaborate in a meaningful way, I'll read it, in a meaningful way with doctors in the care of patients. The AMA has proposed that if nurse practitioners and midwives wish to provide MBS funded services and prescribe MBS subsidised medicines, they must enter into a collaborative care agreement with the patient's usual GP or a doctor nominated by the patient. Well, since then, it's come to become clear that it's not just a collaboration with the patient's GP, it's a collaboration with usually a private doctor. So in the case of midwifery care, it's an obstetrician. And pretty much the obstetrician is can at any stage withdraw care from that midwife, from that collaboration, from that midwife, and pretty much leaving her uninsured and unable to practice in her professional capacity. So if the doctor says, yes, that woman can deliver at home, birth at home, yes, we'll cover everything, and then at 32 weeks her blood pressure starts to go up, that doctor can just say nope, that's it, I'm done, you're no longer legally insured to practice in Australia in that capacity with this patient, and it pretty much forces that patient to go to hospital or choose other alternative ways to birth. So that's what it was put off for 12 months. I believe it's going to come into effect this year. And it's basically like women should be allowed to choose to birth wherever they want. It's 1% of Australia's population that actually, births at home. 1% of Australia's population is a very, very small amount. Our population is 22 million people. So, 1% of that is very small. And, for the Australian Medical Association to decide that that's how it's going to be, that you can no longer have a collaborative agreement with just with an independent midwife who should be considered a specialist in her own field. Like, they've trained, that's what they're trained to do. They're trained to be independent midwives. They're trained to be with women to help them through all areas of birth. And now the doctors can just say, no, we're not going to insure you. No, we're not going to allow this to happen. And as is the case of a lot of the women that I know, they are choosing to birth with an uninsured, unregistered midwife, which is their choice, that it's a birth person, or they're choosing to free birth in Australia. And in a lot of cases, I think it's perfectly reasonable to allow a woman to free birth, or not allow a woman. It's you don't allow anyone anything. I'm not sure I would have been able to choose it. I think I'm not scared of birth. I think I could have had Amelia, no problem without a midwife there, but for a first-time mother to have to choose that would be very frightening. So I guess the main thing that most people are up in arms about are that a lot of women in Australia have very, very bad hospital births, and to then be told that they won't have the support to birth at home. And there is a public home birth system, but there are a lot of criteria that people don't meet. Like, once you're over 35, you can't birth at home. If your BMI is over 30 or 35, you can't birth at home. If you have high blood pressure, if you have gestational diabetes, there's a whole lot of factors that automatically just stop it from happening. So to take away, a woman's chance to birth at home is just ridiculous. So, I guess that's all I figured I could talk about. I've not had any issues with breastfeeding in public. No one's ever asked me to stop, and no one's ever asked any of my friends to stop either. So generally, we tend to breastfeed in large groups, so they don't tend to come near us. But I've breastfed in a lot of places, and no one's ever asked me to stop or to cover up or anything. So I'm looking forward to hearing what the other girls have to say, because I'm sure that a few of them have had more hassles than I have, and I'm curious to see the difference between the Australian system and the US system as far as that goes. So, all right, I will see you again soon. Bye.